Thank you, Dr. Menon. It's a pleasure to be here, and I want to thank the organizers for the invitation. It's an honor to be with my co-panelists, Dr. Karandikar and Dr. Anand. So I'm going to go ahead and begin sharing my screen. Um, and as indicated, I'm going to be talking about the risks and the rewards. And I'm going to start with essentially the rewards. And I think that there have been complaints about, I have heard complaints over the many years of people complaining that we should not be doing research on yoga. Yoga is an ancient spiritual discipline, and then if we tease it apart like an experiment, then we start to destroy yoga. And I don't think that this is true. I think that there's a broader need and a broader concept here that we need to be aware of. Now, the popularity of yoga is growing dramatically. And at the bottom of this slide, I'm showing that this popularity is growing in practice in ashrams and studios and yoga centers, gyms and spas. In the United States, 14% of the people have been shown to be practicing yoga. And what we are starting to see in modern society is the implementation in this large arrow into what I'm calling mainstream society. And this is a professional transformation into society's mainstream institutions, the public schools, the workplaces, and the healthcare system. And of course, the only way to really reach all of society is to implement yoga into these institutions, because many of the people that are taking advantage of this grassroots movement are the people who have the knowledge and often the wealth and the income to be able to afford access to yoga. And if we can bring yoga into the mainstream, then we can provide yoga to the entire population. So this is a very high goal and a very valuable goal, to be able to bring yoga to the entire population. But the situation is such that in order to bring yoga into these institutions, we have to have research. That research is necessary to demonstrate that yoga is safe for these populations and these institutions, and that it is effective. So for example, the head of a clinic cannot bring yoga to his patients unless he knows that what they are getting is safe for them and that it can help them in their health care. The same in the public schools. The public schools barely have enough time to teach what they need to teach. So if you want to bring in yoga, you probably have to take something else out. So there must be justification for why yoga is valuable to children in public schools, that is worthy of putting it into the curriculum. And it is the biomedical research that's necessary to demonstrate that. So research, the real reward of research is that it can facilitate the entire population having access to these practices. Now, the field of research is growing dramatically, and there are two basic types of research. There is basic research, which is looking at how yoga works. What are the mechanisms behind how yoga works? This is important because modern scientists and modern society not only needs to know that it is effective, it also wants to know what the mechanisms are. So this field of research has been growing, and whenever a field grows, there are review papers and meta-analyses, and these are an example of a number of these that have been published recently. Things like how yoga reduces stress, yoga and immune system functioning, neurophysiological and neurocognitive mechanisms, stress, and then self-regulatory mechanisms. And we have actually summarized this in our chapter in the Principles and Practice of Yoga and Healthcare. This is chapter 4, the research on the psychophysiology of yoga. And the field of yoga research is growing in this area. And this knowledge about all of the mechanisms is allowing us to actually talk about how yoga works. One example of this is an understanding of how meditation works. Through the many neuroimaging studies that are being done, we are starting to get a real understanding of how the brain works during meditation. We are understanding that it's the executive brain, the prefrontal cortex and the frontal lobe, where the attention networks are, is what is activated when you focus your attention in meditation. And that there are inhibitory connections between the frontal lobe and the limbic system, specifically the amygdala. And this is the mechanism by which meditation can induce metacognition and self-regulation of emotion and stress. So this is very valuable information because it allows us to talk about not only that meditation can be helpful for stress and emotion regulation, but we actually can see the mechanisms of how this is working. And that gives a good deal of confidence and validity to these findings. So in sum, we can look at a logic model that has been driven by the basic research that's been done. Now, much of the research has been done on traditional yoga practices, which include not just the asanas, but also the pranayama, deep relaxation, and the meditation practices. On the physical level, we have very strong evidence that these asanas improve fitness through flexibility, strength, coordination, balance, and respiratory function. And through the mind-body connection, that leads to improvements in psychological functioning. And these results, many studies, they are objective measures. We've measured these changes in centimeters and degrees, and this is very strong evidence. Through all of these practices, we also see improvements in self-regulation of internal state, both physiological and psychological. And the most important of these is in stress and emotion regulation. And over time, we see these changes manifest in behavioral skills, resilience, and equanimity. Through the meditative component, we see improvements in mind-body awareness, also known as mindfulness. When we engage the attention networks of the brain, we improve that function and we increase cognition and concentration, and ultimately achieve this state called metacognition, where we achieve a good deal of self-regulation of our own thought processes and our own reactivity to our own thoughts. And then finally, as people practice yoga over the long term, many people experience these unitive transcendent states, the flow state, which leads many people to a deep transformation and an improvement in life meaning and purpose, which I'm calling pure spirituality. So all of these findings are really supported by research, and all of this research is now a way for us to talk about yoga in modern scientific language, which is the language of modern society. And because we're making changes across such a broad spectrum of human functioning, we see changes in global human functionality on many levels. So the virtue of this is that now we can go into a clinic or a school and use the language of science to demonstrate that yoga has virtue in those settings. Now, another field of research is the clinical application of yoga, so-called yoga therapy. And this is where we are using yoga to treat specific disorders. We published a bibliometric analysis a number of years ago showing this dramatic increase in the number of research papers, and not only just in the quantity of research, but this orange is the randomized control trials, which are the gold standard trials. These are the high quality research designs that give us the most confidence in the results. And when we look more recently, I just put this together in September. This is the number of publications which are either review papers or published meta-analyses with the word yoga in the title and cited in PubMed. And what you can see is a parallel, the enormous number of review papers that are being published every year. And in 2019, it was a record, almost 50 papers were review papers or meta-analyses of yoga research studies. So the field is definitely growing, and these reviews are very powerful because they summarize a broad number of research studies. Now, we've been able to publish this book, The Principles and Practice of Yoga in Healthcare, in which we have collated 60 leading yoga researchers as authors to chapters, 23 chapters that provide the theory rationale for yoga for specific conditions like depression, anxiety, for cancer. This is written in modern biomedical language. It's a modern biomedical textbook. This essentially is our face to modern medicine. This is our field saying essentially that we have a place in modern medicine because we are in the language of modern medicine and we have evidence to support these practices. So that's the importance of this. Now, when we look at the bibliometric analysis and look at the quality of research, we can see that at that time when that paper was published, that analysis was done in 2013, we only had 45% of papers with the randomized control trial. So less than half of the publications were of this high quality research design. 18% had controls, which is better, but fully over a third were uncontrolled single group trials. And these are very weak trials. Now, this is understandable because yoga research is really in its infancy. And as the field grows, we will start to see an increase in the number of randomized controlled trials. Another feature of the quality of research, this is from a bibliometric analysis by Holger Kramer. In the research design, if you have a control group, you want to have an active control group. That is the strongest research design. Yet the majority of research designs are either placebo, usual care, or no treatment, or so-called weightless control. So the weakest type of design. And there are many fewer designs with an active control condition, such as exercise or attention or education. Another way to look at how the field moves forward and how medicine works is not just the question of randomized controlled trials, but very rigorous and strong trials that are worthy of publishing in the major medical journals. So what I have listed here is the top 20 medical journals in the world. And when you publish in these journals, you make a huge impact in the field of medicine. So what I've put here are the numbers of yoga papers that have been published in these top 20 journals. And what you can see is that we have 4 papers published in the journal Cancer and 4 papers published in the Journal of Clinical Oncology. So clearly the studies on yoga for cancer have really dominated the field of yoga research. In Lancet, we have 5 papers published. However, these are ancient. A number of these papers were published out of the UK in the early 1970s. We've had only 3 papers in the Journal of the American Medical Association. We've had 3 papers in the Annals of Internal Medicine. Now, all of these papers were on low back pain. Now, what I'm going to show you next is the consequence of publishing in such strong journals. We have good papers with respect to yoga for low back pain and good papers with respect to cancer. That has manifested into what we call consensus statements. These are policy statements by a group of scientists who represent the field. And so recently in 2018, the Journal of Clinical Oncology, its leading clinical journal, made a policy statement about yoga for cancer patients. So this was the American Society for Clinical Oncology. They recommended yoga for anxiety and stress reduction, yoga for depression and mood, and yoga for quality of life. And similarly, the European group in the Annals of Oncology also recommended yoga, which could be an option to improve cancer-related fatigue. Now, the virtue of these kinds of consensus and policy statements is this is what doctors read. This is what goes to the clinic. This is what doctors then implement to their patients. So this is how this research gets to the public. And then in terms of low back pain, we also now have policy statements as a consequence of these powerful publications. Yoga is one of the recommendations by the American College of Physicians for the treatment of low back pain. And then similarly, the Veterans Administration in the United States has also made their practice guideline and has included yoga as a possible non-pharmacological therapy. There have been a couple of other policy statements based upon studies that are not very strong. So this is rather surprising. In the American Academy of Pediatrics, they have noted that yoga appears to be a promising complementary therapy. And there have been a few papers, but not very strong papers. So this is really an exception to the rule. And another example of an exception to the rule is the Canadian practice guidelines for the treatment of children and adolescents with eating disorders, because there have been a few studies of yoga for eating disorders, but not many. So again, this is also an exception to the rule. So really, if you want to reach yoga deep into the medical clinic and convince the doctors that this is part of their opportunity to use a therapy that is validated, you need these very strong RCTs published in major medical journals. So those are the rewards of being able to use modern biomedical research of high quality published in our leading journals. And I'm including this quote from our colleagues at NIMHANS, Dr. Varambali and Dr. Gangadhar. This is specifically on yoga for psychiatric disorders. However, this applies to all of the field of medicine, in fact. And a number of issues remain with respect to the research on yoga, and the interaction of yoga with pharmacotherapy, the dosing of yoga, the influence of particular lineages, how to measure changes in yoga, and other limitations in terms of pragmatic study protocols and generic yoga modules. But the conclusion is what I've been saying. For it to be embraced by the medical and scientific communities, it needs to be backed by methodologically robust evidence for its efficacy and neurobiological underpinnings. So now I'm going to come to the risks. And being a scientist, I am, of course, on the side of biomedical research, so I only have one page that describes the risks. But these are nevertheless real risks. These are the risks of doing biomedical yoga efficacy research. And one of the risks is that yoga treatment protocols are not individualized. These are standardized protocols. These are one size fits all. All the patients in the trial get exactly the same protocol. Now, from the field of integrative and holistic medicine, this is an example of treating the disease and not the patients. And as a consequence, this may be ineffective or even harmful. So for example, in generalized anxiety disorder, people have different versions of that disorder, even though they are classified in the same group. So one group of patients may benefit and another group of patients may not benefit as well. And in the field of yoga therapy, the emphasis is on individual treatment, treating the patient individually and addressing the patient and not the disease. That's an important feature of integrative medicine that is lost in these types of clinical trials. Another feature of yoga studies and yoga clinical trials is that the yoga treatment protocols include only a subset of yoga. So typically they will only include the asanas, the pranayama, the relaxation, and some meditation. They will leave out many practices that are involved in a yoga lifestyle, things as dietary changes, shot kriya, and then the focus on contemplative practice and spirituality. And as we know, yoga is a complete lifestyle practice that includes all elements of one's life, not just the asanas and the pranayama and the meditation, but many other practices. And so we are shortchanging, if you will, the patients in these studies by leaving out these many practices and portraying something that is not complete with respect to yoga. The final point is that patients in yoga research studies may not subsequently adopt a yoga lifestyle. So a patient comes into a trial to treat his low back pain. He gets a few asanas to do. He does those asanas, his back pain goes away, and that's it. He goes away and doesn't practice yoga again and doesn't understand that yoga has so many more benefits and can become a complete yoga lifestyle to change many different aspects of his life. So that can be sort of a consequence of using yoga as a pill, if you will, to treat a very specific disorder, to use it as a very specific prescription. However, although these are risks and criticisms, there are ways to mitigate all of these. And there is an emphasis moving in the field of modern medicine to do more pragmatic trials, to do trials that are individually tailored, to take a population of people with low back pain and allow yoga therapists to individualize therapy to each of those patients. So it is possible that we could do this kind of research in the future. So I thank you for your attention, and I'm happy to answer questions later in the panel.